Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology and gastroenterology. Our topic today about syphilis. What is syphilis? Syphilis is an infection caused by a bacteria. Symptoms of syphilis include small sores, ulcers on your penis, vagina, or around your bottom, anus. These are usually painless and you may only have one of them. Sores in other areas, including in your mouth or on your lips, hands, or around anus. White or gray warty growth, most commonly on your penis, vagina, or around your anus. A rash on the palms of your hands and the soles of your feet that can sometimes spread all over your body. This is not usually itchy. White patches in your mouth. Flu-like symptoms such as high temperature, headache, and tiredness. Swollen lymph nodes glands. Patchy hair loss on the head, beard, and eyebrows. It can take 3 weeks or more for the symptoms of syphilis to appear after you are infected. Most often, it spreads through sexual contact. The disease starts as a sore that is often painless and typically appears on the genitals, rectum, or mouth. Syphilis spreads from person to person through direct contact with this source. It also can be passed to a baby during pregnancy and childbirth, and sometimes through breastfeeding. After the infection happens, syphilis bacteria can stay in the body for many years without causing symptoms, but the infection can become active again without treatment. Syphilis can damage the heart, brain, or other organs. It can become life-threatening. Early symptoms can be cured, sometimes with a single shot of medicine called penicillin. That is why it is the key to get a health core checkup as soon as you notice any symptoms of syphilis. All pregnant people should get tested for syphilis at their first prenatal check-up too. Symptoms: primary syphilis. Syphilis develops in the stages. The symptoms vary with each stage, but the stages may overlap, and the symptoms do not always happen in the same order. You may and the symptoms do not always happen in the same order. You may be infected with syphilis bacteria without noticing any symptoms for years. The first symptom of syphilis is a small sore called chancre. The sore is often painless. It appears at the spot where the bacteria entered your body. Most people with syphilis develop only one chancre. Some people get more than one sore. The chancre often forms about 3 weeks after you come in contact with the syphilis bacteria. Many people who have syphilis do not notice the chancre. That is because it is usually painless. It also may be hidden within the vagina or rectum. The chancre heals on its own within 3 to 6 weeks. So, the secondary syphilis, you may get it as a rash while the first chancre heals or a few weeks after it heals. A rash caused by syphilis often is not itchy, may look rough, red or reddish brown, may be so faint that it is hard to see. The rash often starts on the trunk of the body that includes the chest, stomach area, pelvis, and the back. In time, it is also called appear, could be appear on the limbs, the palms of the hands, and the soles of the feet. Along with the rash, you may have symptoms such as wart like sores in the mouth or genital area, hair loss, muscle aches, fever, sore throat, tiredness, also called fatigue, weight loss, swollen lymph nodes. Symptoms of secondary syphilis may go away on their own, but without treatment. They could come and go for months or years. Latent syphilis. If you are not treated for syphilis, the disease moves from the secondary stage to the latent stage. This is also called the hidden stage because you have no symptoms. The latent stage can last for years. Your symptoms may never come back, but without treatment, the disease might lead to a major health problems, also called complications. Tertiary syphilis, after the latent stage, up to 30% to 40% of the people with syphilis who do not get treatment have a complications known as tertiary syphilis. Another name for it is late syphilis. The disease may damage the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. These problems may happen many years after the original untreated infection. Syphilis that spreads at any stage, untreated syphilis can affect the brain, spinal cord, eyes, and other body parts. This can cause serious or life-threatening health problems. Congenital syphilis. Sometimes pregnant people who have syphilis can pass the disease to their babies. Unborn babies can become infected through the organ that provides nutrients and oxygen in the womb, called the placenta. Infection also can happen during birth. Newborn with congenital syphilis might have no symptoms, but without fast treatment, some babies might get sores and rashes on the skin, fever, a type of discolored skin and eyes called jaundice, not enough red blood cells called anemia, swollen spleen and liver, sneezing or stuffed, drippy nose called rhinitis, bone changes. So all these complications can affect the newborn. Thank you very much.